Hi, this is Jessica DeMassa, and I'm here with Michael Joseph. He is the founder and CEO of Prime Dimensions, as well as the executive director of the newly launched empathy.health. But most people know him as Health Data for All on Twitter. So Michael, welcome.
Welcome. Thank you, Jessica. It's great to be here with you at HIMSS 18.
Fantastic. We're happy to have you. All right, so tell me about empathy.health. What is this?
Well, it's a trend I noticed just sitting afar on Twitter, looking at conferences last fall, and the hashtag empathy was trending quite noticeably by a lot of healthcare leaders in the industry, thinking that maybe there's an empathy gap or just more emphasis on it, especially in the digital health world. So I just serendipitously found that empathy.health had not been registered, and I did so, and after speaking with others in the industry like Dr. Raju Stresa of UPMC and Dr. Adrian Boise of Cleveland Clinic, as well as others such as Empathy Princess on Twitter, Miriam, momentum built, and we had a mission now to put empathy at the forefront of digital health transformation, and that's where it comes from.
That's so right on message for you, because on Twitter, that is all we hear from you about is empathy. We hear about the patient experience and patient connection. And one of the things that you advocate for that I think is so beautiful is how you connect the patient experience to data. So I want you to explain to me your view on how the data that we're collecting can really be brought down to the patient level and improve engagement.
Yeah, Jessica, we're seeing a lot of great innovation here, maybe even leapfrog innovation into the 10 years from now with AI and blockchain, but really there's patients today that really need access to data and in a way that makes their care better in their daily lives. We're moving from an era in value-based medicine from this episodic care delivery model with spikes in costs and lower quality as a result because of patient dissatisfaction. So what we're trying to get is this continuous care model through virtual health, telehealth, and other types of solutions. I really do think it starts with, at the population health level, getting more granularity into that data, and then augmenting that data and informing the care management solutions accordingly, along with evidence-based guidelines that already exist. But if you inform it better with the cohorts that you're trying to get healthier, like a diabetes cohort, and get more granularity on that patient, and embed the evidence-based guidelines, what you know about the patient, how their behaviors are going to best be changed when they're home, I think it's a fantastic opportunity right now to really look at that and embed maybe like machine learning, event processing type tools that are very lightweight, but getting to the next level of genome, I think that's the future.
You are one of the most active and positive patient advocates that I feel like I follow. Yeah, for sure. I mean, you definitely are, and I think you're always so optimistic about the future of healthcare. So what are you most optimistic about for the future of healthcare?
For me, as a cancer survivor, the moonshots, I know there's patients today out there right now that are struggling. My message to them, just have hope. The cure is coming, and if you don't have a cure, you probably have a longer lease on life with the technologies, the immunotherapies that are out there now. The cancer moonshots with former Vice President Joe Biden and Startup Health Community are a fantastic platform for people, like-minded people, to come together in a multidisciplinary way to solve this problem that plagues so many people. So that gives me a lot of hope. And underpinning all that is really data in the human genome that goes with it on those tumors and different types of care pathways that would treat those tumors.
I love how you tie all of this together, because I think to hear you talk, it's like you bring the patient into everything that you say about all of these different innovations and all of these different ways that we can help manage and deliver care better. One of the other things I feel like you contribute to so positively is to the conversation on Twitter. So talk to me about your Twitter sphere. I mean, you've got the pink soxers, you've got the health data people. I mean, give some shout out, give some love.
Well, on the pink socks front, they're gone viral is an understatement, and they're here. I think Nick Atkins said there are 30,000 pairs, maybe more out there. I was just serendipitously ran into Nick in Washington, D.C. in 2015. Never saw him before. He doesn't blend. And here he is giving me a pair of pink socks. And I got them from him. I got them from Nick. I got them from you. Thank you. And from that day forward, it was a meaningful thing, and it was something that took a while to catch on, and I didn't understand the whole concept for probably 6 months until I started trending on Twitter more and more. I had my pink socks in a drawer, and then I started wearing them more. I'm like, I need more now, right? Yeah. So that was that. Then I like to thank Colin Hung and Joe Bababian for the hashtag HCLDR tweet chat. It's a really powerful platform, really gets people engaged every Tuesday night. I don't know what cable news programming is on, but I'm always turning off the TV, and I'm on Twitter for HC Leader every Tuesday at 8:30 Eastern. Hi, Joe and Colin.
That's awesome, and seriously, for those who don't follow these things on Twitter, it really takes all of the things that you hear at a conference like HIMSS and really pulls it home and really brings it down to a level where you're talking about everyday integration of these ideas and innovations. Yeah. Last thing for you, I guess. So I wanted to ask, we've been asking everybody, so we're talking about WTF health, right? So it's like a lot of times people are like, oh my God, healthcare is so broken, WTF health. And we're asking everybody, for me, that stands for what's the future, right? So we're asking everybody, what's the future for health? So as far as what you see from your vantage point, as somebody who's advocating for patients, as somebody who's keeping the conversation focused on the patient as consumer and really talking about, bringing access to data to everybody, what do you see as the future for that? Are we getting close to that? Are we going to achieve it? What needs to happen?
Yeah, and I appreciate your acknowledgement of my patient advocacy, but there are so many the Society of Participatory Medicine, e-patient Dave, Amanda Green, so many patient advocates out there, and I really love interacting with them. And I think their voice, especially how they coalesce patient leaders at WeGo Health, to put them back into the system for their guidance and also sharing their stories to help other people with similar conditions. So I think social media and that interaction really does help people with these chronic conditions that they're living every day and notice other people feel their pain, getting back to a little bit of empathy, right? But I do think that moving forward, we need to focus on community-based care, ensuring that people that need care get access to care. Yeah. It's a policy issue as well as a business and technology one. And we know that everything and most that's complicated is people, process, technology in that order. So the people have got to come together. It's a multidisciplinary approach. They are doing that. You see that here. Doctors are here. Patients are here. I think open door for complementary access. Thank you, HIMSS, for that. And it's just that's what we need. And I really think if we bring it home with technology that really focuses in on the top chronic conditions and then wellness. We have this notion of it's really sick care. We treat high acuity when it happens. The 5-alarm bell comes on and you're getting treated. Hopefully you have insurance and you're getting treated. How do we mitigate those 5-alarm bells so we have people that are healthier in a wellness society, and corporations need to be involved. And payers need to be involved, and they are. They're bringing wellness programs to employees. It's in everybody's best interest to have healthier employees, and everybody's getting that memo. So it's a team sport, it's a community sport, and
it's a contact sport,
and it can be dangerous out there. But I think everybody, not just me, we're all in it for the patient. And if you haven't been a patient one day, that's great. Unfortunately, most likely everybody will be.
Yeah. Thank you so much for sharing your perspective. I think you have such a brilliant look at things. You're such a consumer of so much information, and it's lovely to hear you tie it all together. Thanks a lot, Michael. It's a pleasure to speak with you. Pleasure to be with you. Good luck with empathy.health. And again, that healthcare leader chat on Twitter is #HCLDR, and Michael is at Health Data 4 with the number 4 all. Thanks so much for joining us. I'm Jessica DeMassa.